Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews here in the studio today with Maynard Nexsen healthcare attorney Matthew Roberts. Matthew, good to be with you.
Good to see you.
We are joined today by a nursing leader with a very impressive resume. Terry McDonnell serves as the Senior Vice President and System Chief Nursing Executive of Duke University Health System and Vice Dean for Clinical Affairs for Duke University School of Nursing. Terry, thank you so much for joining us today.
It's a pleasure to be here with you all.
Can you start us off just by talking a little bit about your career path from a frontline nurse to your current roles with Duke Health?
Sure. Well, nursing actually is a second career for me. I came to nursing about 25 years ago, and I started as a student nurse and a nursing aide in oncology, and I actually never left. I'm still, to this day, an oncology nurse practitioner. And really, in nursing, it's quite remarkable. If you have the willingness and you want to take on more and think creatively and bring your talents to the work that you're doing, you're always going to have opportunities to grow and progress. And that's exactly what happened for me. I started on the very, very, very front lines, became a nurse, then a nurse practitioner, and grew clinically and administratively at Mass General Hospital, where I served in the Cancer Center for 14 years in various roles. When I left MGH, I was the director of clinical services for the Cancer Center. And then I went out west to Seattle, where I became the chief nursing officer and essentially chief operating officer for what was then the Seattle Cancer Care Alliance, and then worked with the organization through a restructuring and merger to become the Fred Hutchinson Cancer Center. And in my 8 years there, I was exposed to all kinds of things, everything from managing through the pandemic to building a brand new $300 million clinic building and everything in between. And in the last year, I was recruited out here to serve as the chief nurse executive for the Duke University Health System. And, every step along the way, I've been able to learn and grow and really continue my clinical practice. But nursing is such an incredible career with so many open doors that open for us.
Well, Terry, you're clearly passionate about empowering nurses, working as a team, and fostering good cultural workplace culture. Can you talk a little bit about how you do that in what is otherwise a very difficult job, particularly in the hospital system? It's a tough job. It's 24/7, 365, a lot of stress. How do you try to create a good workplace culture and a sense of belonging for nurses that work with you?
That's a great question. And we've spent a lot of time focusing on that, especially here at Duke over the last several years. And I would say first and foremost, it's being present, it's engaging with the staff, it's asking questions. I mean, this past year, Nurses Week alone, we must have done at least 15 to 20 just roundtable sessions with frontline staff, just asking them what was important to them. What things did they feel like we should be working more on, that we should put down, that we should think differently about? And really, when you create that culture where the front line feels like they actually have a say in the work that we do and how we manage the organization, that is meaningful. I mean, we've got tiered huddles. Something can happen at 6:30 in the morning on a unit, and by 9 a.m., myself and the other executive team leaders will know what's happening, whether it's supply chain, whether it's an unfortunate incident with a patient fall, whatever the case may be. We're connecting the wires, and it's that level of engagement that really builds that strong culture.
And I know on the front lines that when you're touching patients, you have to have compassion. Talk a little bit about the role nursing teams play in the delivery of compassionate care, and then also what you do to help with that culture and to help ensure the patients feel that compassion and care in a dynamic setting.
We are there at the most important transitions in many cases of patients' lives. We can be there at the very beginning of life and celebration, and we can also be there at some of the most difficult times for our patients and our families. And I always encourage our nurses and even our student nurses to hold that with tremendous respect. It is an honor. The other side of that is you leave a lot of yourself in that work. And as an organization, we have to make sure that we give our staff, and not just our nurses, but our providers as well, resources and tools to help manage all of that. You know, we use this term work-life balance quite a lot, but when you're carrying that amount of responsibility, you need to have the ability to come together, decompress, to process, and to really support. And sometimes that's a coffee conversation, and sometimes that's, you know, groups coming together and talking through a difficult experience or a conversation. And I think organizationally, what that looks like is we have a lot of different tools that we can access. We've got resources all the way from chaplaincy to social work to family assistance for our staff that helps them be best equipped to deliver that truly compassionate team-based care at the front line.
Terry, most healthcare providers have a multi-generational nursing staff, meaning you've got some brand new nurses and you've got some nurses who've gotten more experience, and they all bring different things and have different ways of looking at things. How, as a leader, do you try to bring everybody together so that the younger nurses get the benefit of the experience of the nurses with more experience and vice versa?
We have 5 generations by last count.
Wow.
And we've actually been talking about this quite a bit in the last year. And you're absolutely right. The needs are different based on the generation, and the expectations are different. And unfortunately, over the last several years, we've actually lost more of those senior nurses, that most senior generation of nurses. So we've had to think differently about some of our models around education, training, and support. Also, how we've designed our career ladders, what people are looking for in career progression. You know, there was a long time, especially when Magnet was first really hitting the stage. Nursing was very focused on advancing your next highest degree projects. And what we're finding is that there's a brand new generation of nurses that really wants to focus on being truly excellent nurses. They want to focus on the work. They want to focus on the bedside, maybe less about getting that next degree and more about really ensuring that they are delivering the best possible care that they can. So then what does that mean for me? It means I've got to have a whole menu of opportunities for our nurses. Nurses, millennial and above, if they want to progress into leadership roles and they want that next degree. We're really fortunate here at Duke because we've got the Duke School of Nursing, and we've got opportunities where we can support nurses to that next degree, that next level of leadership. But also we're re-engaging in unit-based education and support at the front line to really help those nurses who want to get those skills honed and truly excellent, that they've got the resources that they need. So we've had to really shift our thinking. It's not a one size fits all.
And this has changed over time, as I know, in the decades, past few decades, the role of a nurse has changed. And it's probably going to continue to change, what I don't know, but especially in the post-pandemic world, where I think many of us, like myself, became more aware of the burden, from my viewpoint, that they carry from doing the incredibly tough job that they do. What, in your view, does it mean today to be a nurse compared to maybe what it did when you started?
You know, it's interesting. I think we've somewhat come full circle. So when I started, again, it was 25 years ago, and there was a little bit of uncertainty in the workforce. We had this looming threat of not having enough nurses, but then what it meant to be a nurse was changing and evolving. And there were some times where we thought maybe we have too many of a certain kind of nurse, and fast forward to today. And we have come through a time where the narrative was truly about the burden of nursing. And, we had this narrative around nurses being heroes. And unfortunately, there was also a strong narrative around the nurse as a victim. Today in 2024, when I think about nursing, I think we are incredibly fortunate in the incredible myriad of opportunities that are in front of us. I also think nurses have an opportunity to be leaders in what the future models of care are going to become. I mean, we all know that it's no longer about the single person that delivers care. It's about the team. And what does that team-based model look like? And how can nurses best utilize their skills and their training to be leaders in that team? We are at a time where I actually have incredible optimism on what being a nurse of the future is going to be. And we've got all of these tools that are coming to us, AI, things that are going to make the work evolve and change, meaning that we truly are going to have greater opportunities to contribute more to what it means to deliver healthcare in this country and create a healthy environment.
Right. Well said. Let's look at the future a little bit, and let's talk about what are the major changes you might anticipate in the nursing industry, focusing things on like scope of practice. As we see nurses begin, almost every state has some legislative inquiry as to, can we expand the scope of practice for nurse practitioners or CRNAs, and there's a lot of support for that. From a payer standpoint, I think you're seeing the payers get more comfortable with nurses practicing independently as well. And talk a little bit about what you see the future of the nursing industry and how that might look.
So I think, just as I said before, we are at a juncture. I've been a nurse practitioner for 20 years, and I've practiced in states where I have independent licensure and states where my licensure is contingent upon having a supervising physician. And I do think my hope, my dream would be that we have an opportunity to develop national standards that provide clarity as to the scope and depth of the practice of an advanced practice nurse or a nurse practitioner. I also think we've got opportunity for traditional licensure RNs and probably expanding the scope of the RN more in a support model in that team-based dynamic that I discussed earlier. Technology is going to bring enhancements, making, I think, the task work easier, the administrative burden work, documenting, charting. With AI, hopefully with smart rooms, we'll be able to have the capability of having more predictive ways of avoiding harms for our patients. The big harm that we deal with, not only locally, but globally, is patients falling. And when you've got somebody who's deconditioned and sick and they fall, they are at risk of greater injury and really bad outcomes. And those are the things that we're hoping that technology is really going to help us mitigate. But that means that frees up time and greater ability for the nurse to help deliver more advanced care, coordination, and really think about those transitions, because it's not just about the hospital episode, it's about the episode beyond. And how do we thread nurses through that continuum of care to not only make sure that patients have easy transitions out of the hospital, but also that we prevent patients from ever coming in. We're seeing nurses more in the forefront of triage and also in early signaling, in early mitigation, hoping to avoid patients from ever needing the hospital. So, the changes are coming fast and furious, but imagine a world where we need to utilize hospitals less because there's been somebody working with us to avoid ever needing those advanced resources.
That'd be wonderful
Yes,
if that
it
was
would be.
the
Yeah.
case. You've been great today. Thank you. If we could just wrap up, maybe lastly, you share some thoughts about what would you want to leave with patients and maybe physicians, your thoughts about what you'd want them to know or think about nurses.
Well, I think for our patients, it's really understand that we're here to help, support, guide, be your partners, and to help you through those difficult transitions. I think one of the things we learn a lot about, and we're hearing more and more, is that we've got escalations in behaviors and expectations. And I would say to patients that are seeking our care, know that we're here to help you and that we want to partner with you and that we know that this is a difficult time for you, but that also we're going to do the best that we can and we'll work together and maybe have a little bit of compassion and kindness for those of us that are here to help. I think for our physicians, I mean, I've had the pleasure of working with such tremendous physician partners, and I continue to see that here at Duke. We've got the opportunity to partner together and to really think differently about what healthcare delivery is going to look like in the future, but only if we come together and we value and understand that we all want to work at the top of scope and license.
Those are good final thoughts. Well, we're
Really good.
we're thankful that you're back on the East Coast. And Terry McDonnell, she is the Senior Vice President and System Chief Nursing Executive of Duke University Health System, also Vice Dean for Clinical Affairs at Duke University School of Nursing. Thank you so much for joining us today, sharing your insight with just a tremendous career behind you and ahead of you.
Thank you so much. It's been a true pleasure.
And for those of you who joined us today, we hope you learned a little bit more about the career of nursing, where it's been, where it is, and where it's going. And on behalf of the whole crew here, we look forward to seeing you next time right here on Taking the Pulse, a healthcare and life sciences video podcast.